Good morning, good afternoon, or evening, wherever you are. Thank you for joining us for our second IFOPA webinar of 2021. My name is Hope Newport. I'm the Family Services Manager here at the International FOP Association. And I'm excited to bring you today's webinar about COVID-19 vaccines for the FOP community. Today's webinar, you'll see we have a variety of panelists joining us here. Is going to be presented by FOP medical experts from around the world. So joining us from Japan at the University of Tokyo is Dr. Nobuhiko Haga. From the National Health Services in England, Dr. Richard Keene. From Hospital Italiano in Argentina, Dr. Carmen De Cunto. From UCSF here in California in the USA, Dr. Edward Hsiao. And from UPenn here in Pennsylvania in USA, Dr. Mona Al Mukaddam. So I just wanted to go over, before I pass it off to Mona to get us started, a few little housekeeping things for everyone to be aware of. I know we're all very familiar with Zoom, but in the Zoom webinar feature, you are muted. So as an attendee, you don't have audio, but you can submit your questions through the Q&A button. So if you hover over the bottom of your screen, you should see a little black toolbar, and there's a Q&A box there. So if you have any questions, please feel free to submit them there. If you have submitted questions prior to the webinar, we already have those on our list to answer at the end of the presentation. So we will get to those if you've submitted them ahead of time. But if you have any new questions as our presentation is going on, please feel free to submit those there. There's also a chat box. So if you're having any sort of technical issue and you want to submit that through the chat box, that would be great. We can monitor it there. And I just wanted to remind everyone that we will answer questions at the end of the presentation. And lastly, today's webinar is being recorded. So if you're someone who likes to take notes to keep track of everything you're learning, don't feel rushed. You'll be able to go back to the IFOPA YouTube channel and watch a recording of today's webinar within the next 24 hours. So with that, I am going to pass it over to Dr. Mona Al Mukaddam.
Thank you, Hope. All right. So good morning, good afternoon, and good evening. My name is Mona Al Mukaddam, and I want to thank the IFOPA for the opportunity to present on behalf of ICC members our updated COVID-19 vaccines for patients who are living with FOP. As you can see, we tried to have a representation from all around the world. Of course, we cannot include all countries, and we do recognize that the COVID-19 pandemic is affecting everyone worldwide, but there are definitely regional and local variations as well. So the agenda for today, we're going to be talking about the important strategies to preventing the spread of coronavirus. We'll provide a brief introduction to vaccines, and we'll go over the most updated ICC recommendations regarding COVID-19 vaccines. We will go around the table, and each of us will discuss how COVID-19 has impacted our patient care and research in our local communities. We will also provide links to resources that you can access on a regular basis for updated information, and then we will open it up for Q&A. So I'll start off with some take-home points, which I think are very important. COVID-19 can spread and lead to significant illness. We do believe that our patients with FOP are at higher risk of complications from COVID-19. And we believe that they are at high risk due to respiratory compromise and restrictive lung disease. Prevention is going to be key. And this point, we're going to go over that multiple times during our presentation, but really highlighting the importance of preventing infection with hand washing, wearing masks, and physical distancing. We do highly recommend that family members, caregivers, and close contact of patients with FOP be vaccinated whenever the vaccine is offered to them. In terms of our patients with FOP, we recommend that you discuss vaccination with your doctor. You can contact your local doctor, you can contact your FOP doctor, but this requires a discussion. And as the ICC, we can't recommend for or against vaccination at this point. There are many local regulations, so please check with your local health authorities for advice. So COVID-19 infection is caused by the virus SARS-CoV-2, which is coronavirus. The transmission is primarily respiratory, and the common symptoms are fever, cough, sore throat, runny nose, achiness, loss of taste or smell. But we do also recognize that a lot of patients can be asymptomatic and can be asymptomatic carriers of this virus and can continue to spread the virus. Prevention with masks, hand washing, and avoiding sick contacts is very important. Vaccines are now available. There are several vaccines that are available around the world. There are, again, some variation in the availability. Most of vaccines that are available are intramuscular. And most of the studies that have been done in a relatively healthy population. And so we don't know how it's going to be used in a vulnerable population. The supply continues to be limited, and so the general population might not be vaccinated for a while. If you do suspect that you have COVID-19, please contact your doctor as soon as possible. You want a mask so that you can prevent the spread of the virus to others. And also, we do recommend that you get tested for SARS-CoV-2. And so most commonly, the testing is done through a nasal swab or a nasopharyngeal swab, and that's okay. There has not been any reports of any of our patients developing flare-ups because of the test. Depending on the local prevalence of other viral illnesses as well as influenza, it might be recommended that you get also influenza testing. So take-home points. Prevention is key for all viral illnesses. Avoid sick contacts. So as you mentioned, asymptomatic transmission is possible and can happen. The longer you're exposed to someone who carries the virus, the higher the risk of you contacting the virus. And so try to avoid prolonged exposure. Physically distance yourself from others by at least 3 to 6 feet. Do wear a mask when you're around others. And the rationale for that is you're not only protecting yourself, but you're protecting others. And so when you're protecting others, they're also protecting you when they're wearing a mask. And so try to avoid situations where others are not wearing masks. So a perfect example would be going to a restaurant where everyone has to take off their mask in order to eat or drink. Masks are not recommended for kids under the age of 2. And try to be in areas where there's room ventilation. And so probably doing outdoor events is probably the best way to see people while you're wearing masks, but be outdoors. We do recommend that you wash your hands often and use hand sanitizer often, especially when you're in public places, after blowing your nose, coughing, sneezing. We do recommend that you clean and disinfect high-touch surfaces daily. Watch for any symptoms of COVID-19, and please reach out to your medical team for advice. With this, I'm going to hand this over to Dr. Keane, and he's going to be going over the different types of vaccines, as well as some of the vaccines that are currently available worldwide.
Thanks a lot, Mona. And so I'd like to thank the IFOPA and obviously my colleagues on the panel for this webinar. So what I'm going to just do on this slide is just talk you through what the vaccines are, some of the very, very basic biology, because in reality, obviously, just over 12 months ago, coronavirus was this new condition that we knew very little about. And obviously within 12 months, we've accelerated to have a number of vaccines available, which obviously are, as we'll show, sort of providing protection against the condition. So what you can see on this PowerPoint is just sort of the types of vaccines that are in use, and we've added the names of some of the commonly available vaccines that are available worldwide. So on the left, you've got, because what you're trying to do with a vaccine is to stimulate an immune response to the virus, but obviously we don't want to give the virus with the potential of infection. So on the left, one concept with these viruses is you're giving RNA, which is sort of the coding sequence to the body or the virus to sort of how to replicate itself and how to build the virus protein. And so the Pfizer and the Moderna vaccines are these clever RNA vaccines which which basically get the body to produce the spike protein, which is the protein that's sort of on the outer coat of the coronavirus. And so your body would generate an immune response to this RNA to the protein. Obviously, you're only producing the spike protein, so you're not giving someone coronavirus with those sorts of vaccines. And then on the middle, you can see the sort of circle around the viral vector. And this is the technology that's been used for the AstraZeneca Oxford vaccine, but also Johnson & Johnson and the Sputnik vaccine from Russia. And here, what you've taken is you've taken DNA again, in this context, you've taken the spike protein, you've taken the DNA that codes for that, and you're putting it into a normal viral sort of vector, a viral sort of protein that might just give you the common cold. So the idea here is you're giving someone a sort of a simple viral infection, which they might be a little bit unwell with, but you're using that to basically transport the DNA of coronavirus into the body. The body will then make the spike protein. Your body will generate the immunity against that protein. So that's the concept that's being used for that one. And then obviously in the middle, it's not relevant to think that you can introduce virus-like particles, but then with other proteins, what you're doing there is you're giving sort of parts of the viral sort of subunit. So again, you're giving part of the virus that the body will recognize as foreign and potentially thinks it's COVID-19, and then your body will generate the immune response. And then on the far right, you've basically got inactivated virus. So the idea there is you're taking the coronavirus, you basically you make it inactive, so it won't give an infection to the individual, and then your body will generate the immune response to the whole sort of virus protein. So these are the technologies that have been used, and of course, the one thing we have to remember with all these technologies so far is they have been used to provide the immune response against the sort of the classic sort of COVID-19. And as we're aware, there are now sort of variants that have developed across the world. So we're aware that obviously there's a UK variant, there's a South African variant, and there's obviously a South American variant. And so again, the researchers are obviously looking to make sure that these vaccines will work against those other variants worldwide. But again, with the technologies, with the RNA on the left, and probably with the Oxford, the AstraZeneca vaccines, you'll be able to the researchers can tweak how the vaccine is made to then hopefully provide coverage against these variants that we're seeing across the world. Can I have the next slide, Mona? So again, I'm not going to dwell too much on this because I'm sure we'll talk a little bit about this in the Q&As. But obviously, the vaccines that have reached sort of use in healthcare have been gone through the clinical trial process. They've obviously been reviewed by regulatory authorities in individual countries, and so these are the sort of the vaccines that are available. As Mona pointed out in the introduction, almost all the vaccines we have so far are available as intramuscular, so we don't have other routes of administration, and this obviously poses challenges for individuals with FOP. Obviously, you can see that in most patients, in almost all the vaccines, apart from the Johnson & Johnson one, the vaccines, you have to have a sort of one shot and then you get another one at a timed interval. And this again is just how your immune response to maximise the benefit of the vaccine. But you'll stimulate your immune response on the second time, and that gives you a longer lasting benefit. With regards to efficacy, again, you can see different numbers. I think the important thing here is that all the vaccines, when you look at efficacy with regards to severe COVID infection, meaning that you need hospitalization, or with regards to death, the vaccines are very, very effective at preventing that. And some of the endpoints in that column will differ. And then side effects, again, this is something that's quite topical, and again, I'm sure will come up in the Q&A, but obviously we know that most vaccines will give you a sort of a local inflammatory response at the site of the injection, so maybe a sore arm, you might get some flu-like symptoms, and obviously, again, I'm sure you can see the AstraZeneca one, there's been this discussion about blood clots, and again, this has caused some sort of concern in some countries, but again, when you balance some of the side effects against the risks of COVID, the vaccines have a very favourable profile. Again, I'm sure we can discuss more about some of the side effects in the Q&A. So that's a summary of the vaccines. Now I'll hand over to, I think, Ed, who's going to take us through the ICC guidelines.
Hi, thank you everybody, and also thank you to the IFOPA for sponsoring this very important webinar. And to continue on what Dr. Keane and Dr. Al Mukaddam have been talking about, we wanted to tell you a little bit about some of the thoughts from the International Clinical Council on FOP with regards to the vaccines. And I should comment that these guidelines are actually also posted on the ICC website. So if you'd like to refer back to them, or if you would like to share them with your physicians, you should do so. It's at the iccfop.org website. So our recommendations, because of the severity of COVID and the significant risk that this poses to patients with FOP, is that all care providers and family members should be vaccinated with the first vaccine that is offered to them, not waiting for any particular vaccine. It's very important to maintain physical distancing, mask wearing, and hygiene, even if you or people around you are vaccinated, because that is still the primary method of preventing transmission. The risk of COVID-19 complications, the infection complications is high in our FOP community, but the challenge is that the safety of vaccines in FOP patients remains unknown. And the ICC recommends that you consider the pros and cons of a vaccination, just like any other medication or vaccination, by discussing this with your FOP and your local doctor before you take the vaccine. This is really important because each person's risks related to COVID will be different. Each person's risks related to potential complications from the vaccine will be different. And because local rules, local vaccine experience, and reported side effects, all of this are very important to discuss. And I think the other big challenge is that this is a moving target. A lot of new information is coming out on a daily basis. And so making sure that you discuss the potential of the vaccine with your local physician is really important. As I mentioned, the ICC FOP website actually has recommendations if you decide to take the vaccine, and we'll briefly touch upon these. And as of right now, the vaccines are not for children below the age of 16. There is new data that was just released 2 days ago about the Pfizer vaccine for children down to age 12. So hopefully those results will be coming soon. But as of right now, it's only been tested for 16 and above. So just very briefly, if you do decide to take the vaccine, this is a very, very brief summary of the longer document on the ICC website. You should discuss this with your medical team. You should make sure that you don't have a flare for 2 weeks prior to the vaccination. Many sites are requesting no ibuprofen, acetaminophen, NSAIDs like celecoxib, or steroids before the dose. And this is actually because many of the sites have a screening process for COVID prior to getting the vaccine. And if you take these medications, they can't detect things like fever. You should take the vaccine using the route that it was designed for. So as was mentioned by Dr. Keane, all of the current vaccines are intramuscular. We recommend that you follow those directions and use the intramuscular route. You should inject at a site that be less impacted by heterotopic ossification if it were to form. So if there is a joint that is already ankylosed near a muscle, then that would be an appropriate position for the injection. Although, for example, people can take injections in the gluteus muscle. So this is basically your butt. those are difficult places because if you get heterotopic ossification, it can affect sitting. And so we don't recommend that. So this is, again, one of those things you should discuss with your medical team because identification of the site is really important. You should take acetaminophen or ibuprofen for the 48 hours after the vaccination and have steroids on hand in case a major flare occurs. We don't know if this process will prevent all complications. It is our best recommendation at this time. And this is something that we continue to follow very carefully, and we'll adjust the recommendations as we learn more about how this goes. So just very quickly, there are 3 key resources. This is just from, there are many other different types of resources, but these are some of the resources that we've looked over and we feel that are reasonable to share. The first one is the United States CDC for COVID-19 information, just general information about COVID-19 and the coronavirus. There are always questions about how do you care for someone with COVID-19. These are important because the CDC actually has guidelines for caring for somebody with COVID, as well as, for the parents and caregivers if there is a COVID exposure in that situation. And then the International Clinical Council on FOP, COVID recommendations. There's several postings that Dr. Al Mukaddam and the rest of the ICC have put together, and all of those are available on the ICC website for reference. And then just really quickly, as I've mentioned, we know very little about how COVID affects FOP. And so UCSF is helping to sponsor an international study in collaboration with all of the physicians listed here on our web panel today, as well as physicians on the ICC. And so if you have or might have COVID or have been exposed to the coronavirus or are planning to take the vaccine, please feel free to reach out to us if you're interested in participating. The goal is to try to gather as much information as possible to help provide guidance. But if you get or you suspect that you might have COVID, we're not your first point of contact. You should contact your physician first because medical management always takes priority and your safety takes priority. So please do that. It doesn't matter for us in the study if COVID diagnosis is confirmed or not. We assume that that will occur over time. This particular study has basically an interview and medical record review, and we try to track your symptoms and outcome. There's no additional blood draws, testing, or imaging that are required as part of this particular study. And really, our goal is to understand the COVID-19 risks for our patients with FOP. And the easiest way is to directly contact me, and I'll get you in touch with the right people in the study. All right, and so as was mentioned, I think one of the key things for controlling the spread of the coronavirus is masking. It's a cheap method, it's a relatively safe method, and so just to remind everybody, the proper way to wear a mask is to cover both the nose and the mouth. There are a couple of other examples here that you don't want to do. Obviously, if it's not on covering your nose and your mouth, it's not going to be very helpful. The general recommendations so far have been things like a cotton mask, so 3 layers of a high quality cotton or a surgical mask, avoiding things that are single layer like scarves, gaiters, t-shirts, towels, masks with valves. Those do not work to prevent the spread of COVID. And also just beware that there are fake N95 and KN95 masks that are out there. So be careful and source your masks appropriately. And then for those of us who are wearing glasses, just remember that there are a couple of different strategies now. So you can use self-adhesive metal strips or swim goggles or sort of with some goggle anti-fog strategies or some of the newer mask designs with a 3D mask. So those can really mitigate. All right, so with that, what we would like to do is to go into the discussions about how COVID has impacted our care. and research in local communities. We're going to start basically by having each panelist talk a little bit about what's going on in their area of the world. As Dr. Al Mukaddam had mentioned, this is only a very, very, very narrow snapshot. There are a lot of things that are going on. It's very complicated, and each part of the world is different. We're sorry that we can't include pretty much everybody in the different countries, but we hope that this will give you a little bit of a reflection about what's going on and each person's individual thoughts.
All right. All right. So Dr. Haga, do you want to go over what's happening in Japan?
In Japan, I have had no patient with FOP who suffered from COVID. And the situation of the FOP patients, they avoid going outside or going to hospitals. So the one problem is the reduced physical activities in FOP patients. And about the vaccination, in Japan, we only have the Pfizer vaccine, but it started from March, and only the medical professionals working for hospitals have had vaccination. So no patients, including FOP, has received any vaccination up to now. And lastly, on the impact on research, we have experienced 2 clinical trials on FOP patients. One is the palovarotene, and the other is the rapamycin, which is the investigator-initiated clinical trials only in Japan. However, because of the reluctant FOP patients are reluctant to go to hospitals. There exists lack of data. So both of the clinical trials has stopped up to now. This is the impact. And the other research in Japan is the Japanese original registry on FOP, which started last year. But however, this also suffered from the impact of the COVID-19. So the number of patients who are registered are not so many as compared with what we expected. These are the situations in Japan. Thank you.
Thank you. Dr. Keen.
Yeah, hi. So, I mean, obviously, the pandemics affected the care we could provide to patients, both as routine clinical and also from the research perspective. Our sort of small team was redeployed to help on the wards. So I was both a sort of ortho-geriatrician for a while and also a respiratory physician for several chunks of time. But we sort of managed to keep in contact with our patients. And I think one of the positives that's come out is perhaps we've got more used to using virtual means to keep in contact with patients. So I think that's been a plus that has come out in some ways. Obviously, the clinical trials again were paused for a lot of times. There's people not being able to travel, but again we were able to sort of keep in contact with the patients through this quite challenging time. In the UK, the vaccine program has been pretty successful. We've got the 2 vaccines at the moment, the Pfizer and the AstraZeneca one. In the sort of the prioritization, healthcare workers were obviously prioritized, and I was fortunate to be able to have. I've had 2 doses of the Pfizer vaccine with no ill effects. Carers for people with FOP were prioritized, and so again, hopefully in the UK, a lot of family members will have been able to have access to the vaccines, or will be getting them shortly. And I know of at least one UK patient that has had the Pfizer vaccine, and I think has been in contact with Ed to basically make sure that his data is collected. So it has been challenging. You know, obviously things, I think things are picking up now. Our service is much more back to normal, or getting there. But the way we practice will be slightly different. But again, we have been able to keep in contact with the majority of our patients during this challenging time.
Thank you. And Dr. Haga, just maybe if you can add, if you have received the vaccine in Japan, and how's the vaccination been in terms of prioritizing people? Sorry, you're still on mute.
I couldn't hear the last part of your.
Oh no, I'm just saying if you can just comment about how the vaccination's been going in Japan, and if and who's received kind of the vaccines, or so far.
So far, only the medical professionals working for the hospitals, not in the clinics, have received vaccination. Okay. No patients.
Thank you. Dr. De Cunto, how update us from what's happening in Argentina?
Well, thank you, Mona. Actually, in South America, and particularly in Argentina, we are beginning the second wave of coronavirus infection right now. And the rate of vaccination is really low. And that's a problem. We have, in our country, we have 3 types of vaccines. We have the AstraZeneca, Sputnik V, and Sinopharm, the Chinese vaccine. And so far, all the health professionals had received the vaccination, and now they are the school teachers are getting also the vaccination, because the schools are restarted, and also the population over 80 years of age. And now this week, the vaccination has started for the people more than 70 years of age. We don't know if we don't have vaccines so far, or vaccines programs for the people who have any risk factors. So the FOP patients are not in that group. And this pandemic really has changed many things of our daily work with the patients. For example, during last year, all the internal flights and the traveling around the country was really canceled. So a few months ago, we restarted to see patients from the other parts of the country. And in that way, we are now going to restart seeing the patients on the research protocols, for example. But as Richard mentioned, we have a really very good contact with the patients through virtual ways, so remote calls and everything. But we now are going to restart seeing the patients, bringing them to the hospital to see them. And so that's, I think, is the picture. We are very worried about other countries in South America, because in Brazil and Chile, for example, Chile has a good rate of vaccination, but however, they have a very high rate of death and very severe disease. And Brazil is also overwhelmed in the health system. So it's a very worried situation here in this area. I have been vaccinated, I have to tell you that, yeah.
Congratulations. And Dr. Hsiao, can you please give us an idea of the experience that you've had at UCSF, but maybe also some insight on more information that you might have about FOP patients who had COVID or have received vaccination?
Sure. So I think within San Francisco, we've actually been pretty lucky. The San Francisco city was very aggressive at the beginning, and they instituted a lot of mask policies, physical distance policies, and shut down the higher risk areas or higher risk businesses that could be associated with transmission of the coronavirus. And so for us, the infection rate, although has been sometimes high, it hasn't been overwhelming to the hospital system. And I think that like other sites, we have had the same challenges. For clinical trials, we continue only with remote visits. On-site visits are just restarting, so we're going to be doing that very soon. And for clinical care, we had switched primarily to remote, but now basically our hospital is fully open. We bring in, there's no restrictions, except for the testing components for bringing patients in. So that's actually one point that I would like to make, is that it's really important to stay in contact with your clinical team. And if you need to go into the hospital and if you need to get medical care, really, try to make sure that that gets done. It's been challenging because outside of San Francisco has been much more severely affected. We know of hospitals that have been overwhelmed, where there's been insufficient number of beds for patients both with coronavirus and, as a consequence, other medical complications that would normally require hospitalization. And we have had some overflow where those patients are transferred to UCSF. And then I think, now that things are recovering, it's been very helpful in terms of getting patients back into the clinic and making sure that all aspects of clinical care, are caught up. I too have been vaccinated. I actually did have a little bit of muscle aching just right around the vaccination site. I got the Moderna vaccine, but overall it wasn't a problem. And then I think Dr. Al Mukaddam was, and I see that there are a couple of questions that are sort of popping up regarding the study. So we are tracking patients who volunteered to be part of this observational study. This is from around the world. We've had at least 21 patients who have contacted us who have been infected with the coronavirus and have developed COVID-19. There have been deaths associated with the COVID-19, although we're still in the process of gathering details. There's also at least 6 patients that have received the vaccine, and the 6 patients have done pretty well. And so that's actually been very reassuring. And so I think there was one of the questions is why, in the past we have talked about vaccinations and really, avoiding the intramuscular vaccinations. Why are we thinking about, doing a slightly different route in this case? It's a lot of it is just because the potential consequences for coronavirus are very significant, and for some FOP patients, the risks of death from coronavirus is higher than the risks of the complications from an intramuscular vaccine. And all of these vaccines, and any vaccine, when they're designed, they choose a specific route for the delivery for a number of reasons, including how well your body will generate an immune response. And so although for some other vaccines, we have been able to say, okay, well, you can take it as a subcutaneous vaccine or something along those lines. There are very few vaccines that have been actually tested to make sure that it goes that it works as a subcutaneous route. And given the importance of the COVID and the potential complications in the FOP community, we feel that it's important to follow the directions and to take it as it was originally designed. And we can talk about that more during the Q&A session. So.
Great, thank you. So from our perspective, at least locally in Philadelphia and Pennsylvania, we thought we just finished with the second surge, and the cases were starting to come down, but now we're seeing some uptake again where the cases are starting to go back up. We believe that's part of the reason is because of the variants, and it just seems that on the East Coast, when you have a lot more travel from Europe, that we seem to have increased cases of variants of COVID-19. And so we, like all the other sites, we've had to switch to more remote visits with our patients, whether it's clinically or research patients. And so we've been conducting a lot of our visits remotely, but our hospital is pretty open right now, and we are able to see patients in person as well as research patients in the research unit. Some of our patients still don't feel comfortable coming to the hospital because it requires some travel and it requires travel for them and their care providers. And so we've been working very closely with our patients and the sponsors to really accommodate our patients and making sure that they continue to be safe. So we do try to do, blood draws locally, and any safety measure procedures that need to be done are being done remotely. The one thing that I wanted to highlight again, which has been mentioned before, is that it is important to seek medical care. I mean, I personally feel more comfortable coming to the hospital than going to the supermarket. Most of the healthcare providers have already been vaccinated. There's very strict masking and disinfecting protocols that we have in place in the hospital. So it is very important that if you need to seek medical care, you should seek that, and don't let the fear of COVID-19 prevent you from going to the hospital. And that's really not only for our FOP patients, but really for all patients. If you're having symptoms, please go to the hospital and do see your doctors. Hospitals are really taking a lot of measures to keep patients safe. And I too also was very happy to receive the vaccine. Both my husband and I received the vaccine. My husband got the Pfizer vaccine. He had very minimal symptoms afterwards. I received the Moderna vaccine, and I had more significant symptoms. I had a localized reaction. I had some pain around the injection site that lasted less than 12 hours, and then I was completely fine. After the second injection, which is something that we do see, that is commonly seen, you see more of a generalized flu-like symptoms, more so after the second injection than the first injection. And I did get fever and chills that lasted 12 hours after the second injection. And that's why we are recommending that you take Tylenol and non-steroidals after the vaccine, but not before the vaccine, because of some concerns that it might decrease the efficacy of the vaccine. But stay safe, everyone. And as you all mentioned, there's so much information that's coming out, and things are changing literally on a daily basis and an hourly basis. So we try as much as possible to provide updates, but we do recognize that this is rapidly evolving. And I know that we have received a lot of questions. Prior to this webinar as well, I can see there's a lot of questions that are coming in right now. So I'm just going to open it up for the Q&A session right now.
Great. Well, thank you to all of our panelists today. I know your time is all very valuable. So the IFOPA and I know our FOP community appreciates you sharing it to be here to help us stay educated and up to date. And we are going to dive into the questions, starting with the ones that have been submitted ahead of time. And these questions are broken down into categories. The first category we're going to cover is related to COVID-19 symptom management and treatment for people with FOP. So Mona, this one, I know you've kind of touched on it a little bit, but that you had some more you might want to add. If a person with FOP gets COVID, what special precautions should be taken to minimize potential symptoms?
Mm-hmm. Yeah, thank you, Hope. So whenever someone's having a viral illness, you want to try to treat the symptoms. So Tylenol and ibuprofen, if needed, they can take it. I know initially when COVID first hit, there were some concerns that non-steroidals are not good for patients who have COVID-19 infection, but that hasn't really panned out. But as long as their kidney function is fine and they're not having any GI side effects, they could treat their fever that way. It is very important to stay well hydrated, stay in touch with your doctors. A lot of centers are doing regular checkup with their patients who have COVID-19 to monitor for any respiratory symptoms and any drop in the oxygen level. It will be very important to make sure that you don't spread the virus. So if you have COVID-19, you really want to be very careful not to spread the virus to other family members or friends. And so staying at home and quarantining is very important. There's a lot of talk about other supplementations like vitamin D, zinc, melatonin, vitamin C as ways to either prevent getting the COVID-19 infection or to minimize the symptoms of COVID-19. And really none of this is not really based on strong evidence that it really helps. Usually those supplements don't have a lot of side effects, except if you take them in excessive amounts. especially with the vitamin C and vitamin D. If someone has kidney stones, that could potentially increase risk of kidney stones. So always, always, always discuss with your doctor before starting any medications or any supplements to making sure that you're doing it safely and that you're not taking excessive amounts.
Great, thank you, Mona. And in terms of those medications, are there any specific medications that a person with FOP should avoid?
So, yeah, so I think going over as well, kind of thinking about what are the commonly used medications in our FOP patients. And, you know, a lot of our FOP patients are chronically on non-steroidals like Celebrex. And again, right now, we're not recommending that they have to stop taking it. There really has not been any evidence to suggest that it could increase risk of contracting COVID-19 or the severity of it. The story of the steroids or prednisone or Solumedrol, a lot of our patients, are on prednisone during a flare-up. So that question is, prednisone will not prevent COVID-19 infections, and early on in the disease of if someone contracts COVID-19, prednisone can lower the immune system and potentially maybe could make the infection worse. But we do know that later in the disease, in patients who are hospitalized, the use of medications similar to prednisone, dexamethasone has actually been shown to be beneficial. But that's really only in the later stages of the COVID-19 infection and not in the early stages. And we actually favor that patients do not take prednisone if, in the early stages of COVID-19, and obviously not without the direction of their doctors. And as Dr. Hsiao mentioned, and we've mentioned before, try avoid taking prednisone and Tylenol and non-steroidals before getting your vaccine, because it could potentially lower the effectiveness of the vaccine.
And so, Dr. Keen, moving on to you for the next question. Has anyone from the ICC looked into any of the antiviral or antibody treatments that are being developed for COVID?
So, I mean, well, with regards to their use for COVID infection, I mean, again, that would depend on your local circumstances. But, as Mona said, things, obviously dexamethasone has been used for patients needing oxygen support in hospital. There's also use of, there's a drug which has been used in rheumatoid arthritis called tocilizumab, which again has, from trials in the UK, shown to be effective. But I think what you should do is if you get to the severity where your COVID needs to be treated in hospital, and that's when most of these antiviral and other drugs would be used, and drugs that affect the immune system, then the local doctors will know what drugs are available within that healthcare setting and which drugs you should use. But if you're just at home with COVID, then the general advice that Mona's given would be what we'd be advising.
Okay. And I know we just had a couple other questions come in on this topic. For symptoms, is there a recommended dose of medication or a combination of medication doses that you would recommend?
With regards to, if someone's just ill, feeling a bit unwell at home with the virus, I mean, again, it would be the standard dosing of, whatever drugs that, whatever they were taking with regards to paracetamol, celecoxib. I suppose if some patients were on sort of a maintenance dose of steroids, and there are a few patients who might be on a very low dose because they've not been able to wean off, then if they have the stress of being unwell, they might need to increase the steroid dose a little bit just to cover that. But again, that should be in discussion with their clinician, would be my advice in that context.
Okay. And then one more, someone is asking if you have any thoughts about ivermectin. I pronounce it.
Which one's that?
It's ivermectin. Yep.
Ivermectin.
I mean, again, I'm going to pass that on to anyone else on the panel. I haven't got any.
Yeah, so it's not recommended in the United States. I know in like Lebanon, they've been using that, and I don't, again, it's an anti-parasitic agent, and it's usually used as a single dose for parasitic infections. And people have been taking it chronically, and that's not really recommended. So in the United States, we have not been recommending that. Although I do recognize in other parts of the world, they have been doing it. There's really no data to support that it actually works. And I think we have similar concerns with like hydroxychloroquine. Again, that's something that we do not recommend. There is some cardiac toxicities as well associated with that. So really, really need to be careful about recognizing the risks and benefits of whatever treatment option they decide. A lot of these medications have not been well vetted or studied with COVID-19 infections. And so we just really need to be careful about which drugs you want to try.
Thank you. So I think that wraps up the questions we have on that subject. The next topic we're moving on to, something that we've received a lot of questions about as well, is the vaccine specific topics. So I know we've discussed some of the options, things to consider when you're deciding if you should take a vaccine, but Dr. Haga, did you want to expound or share anything else on this topic of if someone should consider taking a vaccine?
I personally think that the patients with FOP should not receive vaccination as much as possible. So I do recommend my patients to refrain from receiving vaccination, but recommend the families and the caregivers to receive vaccination as much as possible. So, but if the patient eagerly want to receive vaccination, and the patient has the locked joints, especially in the shoulder or the hip joint, I think that they can receive vaccination in that area intramuscularly. Okay.
Thank you. And Dr. Hsiao, I know you've been gathering some information about this. The next question is, has the vaccine caused a flare-up in people with FOP? And what are some of the risks if someone with FOP decided to get vaccinated?
Yeah, thanks, Hope. That's actually a really great question. So and this is actually related, I think, to one of the other questions. So in the small number of patients that we know of that we've been tracking with who have decided to take the vaccine, there were a couple of things related to that. One was this was made in discussion with the patient to decide whether or not it was appropriate to consider those, what was the risk and the benefit balance. And in those patients that decided to take it, interestingly, we haven't really seen much in terms of flare activity. There has been some flare activity that may be associated with the coronavirus infection itself. But again, the numbers that we have are extremely small. Getting as much information and from people's experiences, I think, is going to be extremely important for really understanding, what are the risks and related to both vaccination as well as the COVID infection. And I think there was one other question in terms of, whether, how is this information going to be used? The goal is to try to get this information together, so that we can provide guidance. But again, this is an ongoing pandemic. We are in the middle of it, and things will, as we gather more information, things will change. But the goal is to try to get as much evidence as possible to support recommendations for the safe treatment of patients with FOP.
And Dr. Hsiao, can you comment on another question that was in response? You shared that 6 people with FOP have received the vaccination. Can you share any of the specifics of where they received that, if it was arm, leg?
Oh, yeah. So that varies by patient. That's something, again, that is a discussion in terms of where is the lowest risk site for an injection. And I think they're just related to that. I think there was a question that came up earlier in terms of, why should you go to your physician versus, going to a more public site for, a public location for an injection. Many of those public locations are only able to do injections in one location, or 1 or 2 locations, very standardized sites. They don't want people or they can't accommodate people who may need injections at different sites. And so coordinating with your physician is by far the highest priority, because they can help you determine, and they can help, you know, make sure the needle is the right size and all of that. So try to maximize the safety and minimize the potential for side effects.
Great. And one question, kind of the follow-up after vaccination. So if someone gets the vaccine and a flare-up occurs, should they start a course of prednisone?
Yeah, so that needs to be discussed with your physician. So because prednisone is an immunosuppressant, there is a potential risk for decreasing your immune response to the vaccine. And so depending on the flare and the location and how severe it is, there may be other strategies besides prednisone for managing that. So again, that's making sure that you coordinate with your physician is really important.
Another specific question, Mona, I'm gonna pump this one off to you. If the vaccine has 2 doses, are people with FOP able to just get 1 dose to potentially avoid that second intramuscular trauma?
Yeah, so these are all very good questions. And to be honest, right now, we're only recommending that patients take it the route that that is recommended, that has been studied. So the issue of having 1 shot has been entertained not only for FOP patients, but kind of worldwide. But really, the studies have not been done as such. And if someone's going to be taking the vaccine, we might as well take it in a way that we know is actually effective. And taking half dose or taking it in a route that is not what has been studied, it might just put them at increased risk, but we have no idea if it's going to actually help them. So if they wanted to go through the route of getting the vaccine, we are recommending that they do it as recommended, as studied.
Thank you. And then Dr. Keene, back to you for one more specific. So if there's someone who's had a previous ulcer or stomach issues, if they get the vaccine, is it possible, should they take acetaminophen?
Yeah, I mean, so that will be fine, and that, you know, that's not going to cause any problems with the stomach. So yeah, so after the vaccine, if to prevent sort of maybe that low-grade temperature or reduce any sort of muscle stiffness and just general discomfort, which is common after the vaccines, paracetamol in that situation would be fine.
Thank you. So the next set of questions are really more related to which of the vaccines that we heard about from Dr. Keene earlier patients with FOP should use. Dr. Hsiao, I don't know if you wanted to do a little bit of follow-up on that. I know there are some questions in here. One is, you know, regarding the different technologies from different vaccines. Is there any one that is not recommended for people with FOP?
As of right now, there is not. I think the biggest challenge is that the vaccine availability is still very low across the world. And so if you are thinking about taking a vaccine and you decide that that is appropriate for you, then again, this is a discussion with your physician to figure out what vaccines are available and what the potential risks and benefits would be. So that would be something that you, again, have to discuss locally.
I think just to add to that, maybe sometimes we have routinely for FOP patients recommended against live or live attenuated viruses, which right now none of the currently available technologies are using live attenuated viruses, but there could be potential for doing like the nasal vaccines to be a live attenuated virus. But again, I think we're just going to have to wait and see what is available and what could be the potential risks, because as others have mentioned, we usually recommend against intramuscular injections. And here we are saying, you know, maybe you could consider that if you felt that the risks and the benefits are more favorable for you specifically. So,
and actually, I should go back and I think, you know, what Dr. Al Mukaddam was saying is exactly right. If we go back and actually look at the data about the flares related to intramuscular vaccinations, it's limited to one set of studies, pretty much, and those patients received the DPT vaccine, the diphtheria, pertussis toxin, and tetanus vaccine, and it was a retrospective study, meaning that about a third of the patients who were asked developed heterotopic ossification in the area of the vaccine. So there are a couple of things just to keep in mind. One is that, that is a retrospective. That was oh, well, they didn't track patients as they received the vaccine, what exactly happened afterwards. The second thing is that even though we say 1/3 of the patients actually developed heterotopic ossification, that also means that 2/3 did not. And so that again comes down to this discussion about the risks and benefits. For some patients who may be able to fully isolate and do not have any sort of respiratory compromise or any sort of lung complications, it may be acceptable to not consider the vaccine. In those cases, the risk from COVID may be lower. But then there are some patients who live in a nursing home or are in a situation where there is very high prevalence of coronavirus in their community and have severe lung disease, and in which case that might become something of an important consideration. And again, that's why we're recommending that you discuss this with your physician in detail.
So I think this is one of our last questions sort of on this vaccine specific topic. This one is for you, Dr. De Cunto. Since there is still, potentially no adequate vaccine for FOP patients, is the best bet for the time being to achieve herd immunity with vaccines that are 50% effective, contributing potentially less to the goal. So what relevance does this have for, especially for people who maybe are living with someone with FOP, to be vaccinated?
Well, we have heard in the media, TV and everywhere about talking about herd immunity. And normally, what is the herd immunity? You achieve the immunity of a big population through the infection itself or through the vaccination, right? It depends on the disease you are talking about. It's different the amount of immunity you have to get in the population. For some diseases like measles, you need to have between 80 and 90% of the population infected or vaccinated to have this herd immunity. For COVID-19, we don't have that information, and it's very risky. It's not ethical to expose the population to an infection that we don't know a lot about that. The only thing we know that is very severe, it can cause death. So and with vaccination right now in the world, we don't have the amount of people already vaccinated to get this herd immunity. So it's not recommended to think about that. So we have to hope to have more and more vaccinated people and to protect the population that have risk factors with the things we have told this morning about isolation, using the mask, the prevention of infection. They have to be very protected and try not to be in contact with infected people. I don't know if the rest agree with that.
I think everyone does agree. Thank you for taking that question. There was one more that I saw before we move on that was submitted just today. So I think if any of our panelists want to take this question. One of our attendees was curious to get your thoughts about the blood clotting that's been related to the AstraZeneca vaccine.
I think Dr. Keen should answer that one.
So yeah, I mean, look, it's a very fast moving and changing field. Obviously, the problem here is when you're looking at what is quite a rare event in people that are being vaccinated. And so like in the UK, where we've been vaccinated, well, now we've got sort of over 30 million, half our adult population's been vaccinated, and there have been 5 cases of these blood clots. But obviously in Germany, they've been where they vaccinated less, but they've had 30 cases. And there are differences in the age of the population. So I think, at the moment, the regulators are looking at that. And I know that, again, people are, in different countries. So in Europe, they're sort of saying that they're potentially saying that maybe people over the age of 50 could have access to the AstraZeneca vaccine, because perhaps in the younger group, they feel the risk of COVID may not be as great, and therefore these risks. I think we'll just have to wait and see. But again, at least here in the UK, the regulators still think that although there may be a very small risk, the benefits of the vaccine far outweigh that, because also we know COVID itself can also induce blood clots and cause problems with that. So again, I think this is, at the moment, I may say this is a very fast moving, it's almost changing on a day-by-day basis with what the regulators are saying and what the government, each individual government in Europe, different governments are coming up with different strategies. But I think, again, the important thing for me would be that if, as a patient, you would want to discuss with your doctor, find out what the recommendations are at the time, and then review your own case. So it is complicated, but these are still very rare events that are happening. And as I say, I think we just have to bear that in mind. But I would say discuss with your doctor and see what the situation is. Because what we say today may be different. And again, I would sort of say to people who might be looking at this webinar online in a few weeks' time, what we say today might be different. So just do check with your local health provider, because what we're saying now might be out of date.
Yeah. Hope, I just wanted to answer one question that we were asked, just in follow-up, just to clarify one thing. So there was a question about, I mentioned that no live viruses are usually recommended for FOP patients, but then there was a discussion about the Sputnik and the J&J where they're administered through an adenovirus. And so that was a question about whether our patients can take that. And so just to clarify that, although part of the COVID virus is being injected in a vector, which is an adenovirus vector, those viruses are known, they're usually viruses that are in other species and are not known to cause disease in humans. And so although it is a virus, it's not a human causing virus. And so that's why we feel that the adenovirus vectors are okay to be given to FOP patients like the Sputnik and the J&J.
Great, thank you, Mona, for following up on that. So if no one has any further questions about vaccines, we're going to move on to some questions that were submitted regarding general precautions to take. So I know Dr. Hsiao talked about the importance of hand washing and mask. Dr. Hsiao, one follow-up question for that. For someone who has chest restrictions because of FOP, is wearing a mask, does that pose any potential threat or issues?
Yeah, so that's a great question. So for the masks, it is important to discuss again with your physician, because there are certain types of masks that are more challenging for people to wear. So for example, the N95 mask, which is a fitted mask, is very, very tight around the face and can cause difficulty. And so actually here at UCSF, you require medical clearance. So Dr. Al Mukaddam has an N95. So here in UCSF, you do require medical clearance actually to wear an N95. The other masks, like surgical masks, generally are much more free-flowing. Again, if you remember that the purpose of the mask is to prevent spread, and it's what we call source control. It's to prevent the source from spreading the coronavirus to other people who may not be protected. That generally, all of these masks will be very helpful. So as Dr. Al Mukaddam is holding up, that's a surgical mask. There are cloth masks. I can go grab mine. But there are all of these different types of masks that are available. So whatever is comfortable and fits a particular patient well, I think is important. And this will vary from patient to patient because of different restrictions related to the FOP, as well as different types of fabrics and different comfort.
Great, thank you. Dr. De Cunto, one question that came in was regarding schooling. And so for people who have children who are probably interested in returning to schooling, is there any insight on, when or how that could be safe for them?
Well, the school issue is very specific for each country, I think. They have specific rules, regulations. For example, my country, the school started just this past month. And it was a lot of discussion because they were canceled during the last year. And what we have seen is that really infection through schools is very low, infection or COVID infection. So if the school has all the precautions and all the protocols to be safe, I think we have also to balance what is better for that child. If the social interaction and the learning in a different context is better for the child. And another thing that we have to consider is what the kind of pulmonary or lung involvement that that patient has. if the lung involvement is very severe and very restrictive, I think each family has to discuss with the local physician what is better for that child. But it's always a discussion regarding this and the local regulations of the country and the specific problem of that child. Yeah.
Thank you, Dr. De Cunto. Mona, this one comes over to you. Do you have any recommendations, protocols, if someone in the family gets COVID to protect that person with FOP?
Okay. Yeah, I think, I mean, it's really challenging, right? So it all depends on the patient's current living situation. If it's one family member that has COVID, if there's any way for them to, you know, have different areas of the house where they live in, they don't share anything together, or maybe that person can quarantine all by themselves. I mean, that would be the ideal situation. We do recognize that in reality, what happens is sometimes, you know, they are the sole caregiver of the FOP patient. And so they're ending up, you know, they're infected and they have to care for someone. As much as possible, if they can quarantine that person who has COVID-19 to quarantine all by themselves, completely separately from our patients, that would be the most helpful thing to do. If they do have to interact together, you know, wearing those masks is going to be very important. There's, you know, trying to use more of a higher grade mask is probably a better option. There's been some data from the CDC that looked at using a surgical mask and top of it putting a cloth mask, and that seemed to also be more protective in that sense. And so wearing goggles as well, and wearing masks and hand washing all the time and cleaning all the surfaces and minimizing the exposure time as well, right? We talked about the longer you're exposed, the higher the risk of getting the disease. And so it's still going to be, you know, prevention, whatever way possible that they can do it in a safe way.
Okay. Great, thank you, Mona. So moving on to our last category, there were some questions that came in about testing. So Dr. De Cunto, I think we may have covered this one, but in case you couldn't answer it, in case someone missed it, can a person with FOP be tested for COVID-19? The question is it safe to do the nose or the throat swab?
Yes, it is safe, so they can have it. In sometimes it's only needed to do the nasal swab, so there is no problem. They can be tested. Yeah.
Okay. And then this one is for you as well. How can someone differentiate between a cold, cough, and COVID? For some of our FOP community members who live in those places where the flu cold season is upon them.
Okay, well, it's right down the situation here. So, no, it's difficult because the symptoms are very similar. So we have to consider, unless really with all this COVID-19 infection, we have seen less infection for other respiratory viruses. That's true. But here we are now starting the vaccination for the flu vaccine. So the people needs to have that vaccine also. And if they have symptoms, they have to be tested to see if there is COVID or it is another type of respiratory virus. So they have to be tested. In each country is available, they have to have the flu vaccine also.
And then I think the last question that I have today is for you, Dr. Keen. So if someone has a positive blood test, which means that they have indeed been infected with COVID-19, could this prove that they are immune or that at least a little more protected, and that would prevent them from potentially needing a vaccine?
So I think the simple answer would be, I think, you need the vaccine. That would be my recommendation. I think, yes, we know if you've had COVID, you will have produced an immune response. So there is probably some protection, but the immune response you're going to generate from the vaccine will probably be greater and longer lasting. And obviously with the newer vaccines, as they go, you'll get protection against the variants as well. So I would be saying, even if you've had COVID, as long as you leave a couple of weeks after you've had that infection, you should then have the vaccine.
Thank you. So that, I think we've covered all of the questions that have been submitted both today and ahead of time. And I just want to end by thanking all of our attendees for taking some time out of your day to join us, and of course our panelists. So thank you to not just you, but I know all of the members of the ICC who worked so hard to create these guidelines that we need for guidance. So thank you all for taking the time to join us, and there will be a follow-up email that'll go out to all registered attendees with the link to the recording of this webinar. And I know Dr. Hsiao shared some really great links for resources. Those will be included in the email as well. And I think that is all I have for today. So I'll let our panelists say goodbye before they sign off and start their busy days or end their busy days. But thank you everyone for joining.
Well,
Thank you.
Bye-bye.
Stay
Thank you,
healthy.
everyone. Keep safe. Bye-bye.
Stay safe. Bye.
Bye.
Thank you very much.